course, my name is Bradford Azizi, and I'm the treasurer of Health Without Boundaries. Today I would like to introduce Dr. Beatriz Garces. Dr. Garces is a dentist in Philadelphia, Pennsylvania, who is a graduate of the Temple University Kornberg School of Dentistry. She has collaborated with Puentes de Salud Health Center in Philadelphia and also runs the Garces Foundation, which is a nonprofit that was founded to improve the healthcare and education of our immigrants in Philadelphia. So Dr. Garces, it is an honor having you with us today, and thank you for your time.
Yeah, thank you so much for considering me for the opportunity to be on this Q&A and inform the community of all the good stuff that we're doing.
Thank you. So the first question I have for you today is that I know you do a lot of work with the Philadelphia's Hispanic community. So how do you think the COVID pandemic has maybe affected this community?
So I would say that this community is the one that is most affected overall in this country, especially the community that I'm in touch with. They're mostly undocumented, so they don't get access to social services. They don't get access to unemployment benefits, rental assistance, medical care, really nothing. They were completely in the dark before the pandemic, and now really even more. And there's really no programs that are out there available to help this community other than those programs who are created by small nonprofit organizations who want to help these folks. But in terms of government help, there's really zero out there available for these families. And so we've seen a lot of patients and a lot of our constituents who are in the restaurant industry, who, that industry was such hard hit with this pandemic. And in most households, there's one person without a job, if not both, during several months of this pandemic. So by far, I would say it is the most vulnerable community that has faced the consequences of this pandemic.
Sure. Well, as a follow-up, how do you think dentistry maybe has adjusted around COVID-19 and specifically treating the local Hispanic community during this pandemic?
So in my experience, we, through our nonprofit arm, which is the Garces Foundation, we've historically run programs since 2012 to help this community get access to affordable care or free care, among other programs that are in place. And so we here at Garces Dental Group, despite the closures and despite the financial burden that this pandemic had on our business, we kept our commitment to help the immigrant community get access to the care they needed, especially emergency care. We were there for them the entire time. We never closed our doors to them for emergency care. We kept it going. And during that period of time where they couldn't afford anything, we treated them for free.
That's wonderful.
Yeah. And then as the community as some people started to get jobs, they started to come back for other, restorative treatments and periodontal care. But during that acute, scary time of the pandemic last year, we kept our programs going and have kept it going the entire last year and this year as well. So that's related to dental. We also launch other programs as well. We have a food pantry that started back in April, and we feed about 200 families per week. We provide them with fresh groceries that are, boxes that are big enough to feed a family of 4. And it's all fresh fruits, produce, dairy, animal protein, all things that are culturally appropriate. Because anything that we put in our mouth affect our overall health and our teeth. So it's part of our commitment to keeping those patients and those families healthy, and as part of our mission to them.
So that's wonderful. So as a just a more general question in terms of dentistry, what would you say is the most important thing you want to remind patients, and what are some things that you think everyone should know about oral health?
Yes, prevention. Oral health care is inaccessible to a lot of people, and it is very expensive. But if we prevent oral disease by having good home care and good nutrition, then it really does not have to become such a huge problem. So I would say we as dental providers and as a whole, the dental community, we need to continue to make efforts to get the message across to the communities about prevention and improving home the oral care and nutrition.
Sure, sure.
Yeah.
And my last question is in regard to technology, because I know that there has obviously been a rise in technology use. I mean, not just in dentistry, in pretty much every field, but
Everywhere. Yes.
yeah, exactly. And so how do you think technology has helped in treating patients, and where do you see technology taking dentistry in the future?
Oh my God, this is such an exciting time to be a dentist, really. Like, to be able to take a digital impression on a patient and send it to a lab digitally, and they print a 3D model and make your restorations, make your night guards, it's really, it makes things run a lot more efficiently and also even more accurately as well. And it is really evolving fast, though. It's just like the cell phones, with dental technology, you buy something today and 3 months down the line, what you bought might be outdated. So it's really, but it's super exciting, all the cool things that we can do now in terms of implant dentistry also, and CAD scans, and it's really it's important for dental schools to make sure that they implement in their curriculum all of this technology, and for residency programs as well, because people need to get immersed in how to use it, really.
Sure. Yeah. Something I've noticed, especially just like technology in general, you see like phones and like the way the cameras have evolved, for example, it's crazy, even just in the past like 5 years.
Yeah.
Yeah. All right. So Dr. Garces, thank you. I really appreciate you joining us today, and it has been a pleasure speaking with you.
Absolutely. It's been my pleasure to answer these questions, and, happy to be on this type of discussions anytime you need me to.
Thank you so much.
Okay, you're welcome.